Hello, everybody, and welcome to the Royal College of Physicians of Ireland International Residency Training webinar. Thank you for taking the time to attend this webinar or look back on its recording. We hope that you find it informative. We have a great panel here today to give you lots of quality information about both Ireland, its culture, its people, and then also our training and residency training programme, how to prepare and what to expect when you get to Ireland. Okay, so I'm going to cover the first session here, which gives you a short overview of the Royal College of Physicians of Ireland. Next slide, please, Anton. Thank you. So you can see here, this is the online webinar, and you will have talks from both myself, Mr. Adam Lacomber, Miss Paula Kavanagh, and there's a panel discussion at the very end with our clinical professors, Professor Cecily Quinn, Professor Danny Cherian, and Professor Basil. The team in the Royal College of Physicians who will look after you from a recruitment, admissions and onboarding perspective is myself. I'm the director here of business development and examinations. Miss Sinead Freeman, who's our senior manager in the department. Paula Kavanagh, our global training and partnerships manager. Adam Lacomber, the development executive. Anton Bambalak, our Global Training and Partnerships Coordinator, and Susan Halim McConnon, who has recently joined as our Programme Coordinator in Admissions. So that's the team. Any queries you may have, you can reach out to us at any time. There is a QR code which we will share at the end of this discussion where you can download both the brochure for residency along with all of our contact details. So a little bit about the college. The Royal College of Physicians of Ireland, it's Ireland's oldest postgraduate training body, formed in the 1600s, and it's also the largest postgraduate training body. And our mission is really centred around empowering, developing and supporting our community of learners, trainees, members and fellows, really through the lens of improving health through training, education and advocacy. And very importantly, it's to create a global community of doctors engaged and enabled to improve people's health. So the college has been training international doctors for a very long time. This particular residency programme and fellowship programme for the Royal College has over 200 graduates. There are alumni in all parts of the GCC community, as well as other parts of the world. Our values, very similar to your own in your own hospitals, is built around welcoming, trustworthy, respectful, responsive, connecting and challenging. Next slide, please. A little bit about Ireland. We are nicknamed the Emerald Isle because it's very green here. You'll see the icon, the umbrella icon, that does mean it rains because it's so green. And we have a very mild climate with an average temperature of 10 degrees. So it gets to about maybe 3 or 4 in the winter time. And sometimes if we're lucky, up to 23 or 24 degrees Celsius in the summer. We're very well connected, gateway to Europe, to the North America and to the Middle East. So you'll know that there are direct flights from the Middle East directly here to Dublin. So it's very accessible for both family and friends and yourselves as you can come and go from your home country. English is the spoken language. And Ireland's a very safe place to live. It consistently jockeys for first and second place on the Global Peace Index. So you can see we were ranked second in 2025. I'm not sure what we were ranked this year, but when we know, we'll certainly post it. We're home to 5 million people and we're internationally recognised for excellence in postgraduate medical training. So we have a long history of training our national and international doctors over the last number of years. Next slide, please. So Anton is now going to play a video and just to give you a sense of Ireland, its place, its people and its culture. Thank you. Thank you. I'll now hand over to the next speaker, Adam Lacumber, who's going to take you through the details of the International Residency Training Programme.
Thanks, Sinead. Hi, everyone. Hope you're all doing well. Thanks very much for joining us today. So my name is Adam. I'm the Development Executive within the RCPI Global Training and Partnerships team, and I'm going to talk about our international residency training programs. So our programs offer clinical training to international doctors who are sponsored by their government, hospital, or national training body, whilst also providing a unique opportunity to develop professionally as a doctor and learn advanced skills that will be beneficial for the health service in your home country. So on this slide here, I'll talk a little bit more about our programs. So as you can see, we offer 4 specialties across 4 faculties and institutes. So namely the Institute of Medicine, Faculty of Pediatrics, Institute of Obstetrics and Gynecology, and the Faculty of Pathology. The duration of the programs is between 2 to 3 years. However, this will vary depending on the program in question. For further information on each specialty, you can scan the QR code on this slide here to visit our e-brochure. We'll also share this again and throughout the presentation as well. So just moving on to the next slide, I will outline some highlights of the programs. So our programs are fully accredited with overseas health authorities, providing hands-on clinical experience with subspecialty exposure with rotations across Irish hospitals within your chosen specialty, under direct supervision by RCPI certified trainers within a multidisciplinary clinical team, which will focus on an outcome-based structured curriculum, which is delivered via an e-portfolio, including evaluation of your training progress throughout, study days and complementary courses, and also research and audit involvement as well. So on the next slide, regarding clinical and academic supports, each specialty is led by a program director, some of whom are on the call with us today. So the program director designs the program curriculum, selects trainees for the program, assisting in their induction and assessing their progress throughout, also providing support to trainees and their trainers. So we also have our RCPI certified trainers who help new trainees adjust to the Irish healthcare system, works with trainees to meet training goals as per the curriculum, and signs off on evaluations. So moving on to the next slide, we'll just look at the entry requirements for our programs. So you can see here, to apply, applicants must be a citizen of Saudi Arabia, hold a primary medical degree completed in English, have completed or are near completion of a structured internship, possess provisional sponsorship, and demonstrate an appropriate level of clinical experience. So to start in post then, you must have an IELTS of 7 with no band lower than 6.5, or an OET with a score of B across each of the 4 assessed domains. For internal medicine, you must meet the MRCPI Part 1 requirement. Similarly, for pediatrics, the MRCPI Part 1 requirement. For obstetrics and gynecology, you must complete the RCPI, i.e. professional diploma. For histopathology, you must hold the FRC Part 1 unless your medical degree was completed in the EU, so there's an exemption there. Also, you must have confirmed sponsorship with a government body with whom RCPI has an MOU, so in this case, that will be within Saudi Arabia. Next, we're going to watch a short video which highlights a day in the life of one of our current international trainees, Dr. Talal.
Good morning, I am Dr. Tal Zahrani. Welcome to a typical day of my life here in Ireland.
It's an early start for Dr. Talal as he prepares for a busy day at Children's Health Ireland. A short walk from his new home, he begins his day with a sense of purpose and dedication to patient care. Dr. Talal makes his way through the vibrant city of Dublin, the capital of Ireland. Dublin is a safe and friendly city with lots to see and do. At Children's Health Ireland, Dr. Talal is part of a supportive environment where collaboration and teamwork are at the heart of patient care. After a busy morning with patients, Talal meets with his trainer, Professor Des Cox, and other consultants. who ensure he gains experience and exposure to a range of medical cases. Beyond the hospital walls, Talal enjoys moments of respite, savouring the rich culture and making friends in his new home. A day in the life of an international fellow is a tapestry woven with dedication, compassion, and a commitment to making a difference. Dr. Talal is working toward a brighter, healthier future, gaining important experience and skills to bring back to his home country.
Thanks for that, Adam. Good afternoon, everyone. My name is Paula Kavanagh, and I am the Global Training and Partnerships Manager here in the Royal College of Physicians of Ireland. Today, I'll be talking you through the RCPI process for the International Residency Training Programme. So the purpose of this overview is to give you a clear understanding of how the recruitment process will work from start to finish, and to highlight the key stages involved, including timelines, assessment points, and decision-making milestones. Next slide, please. So what are the recruitment stages? The recruitment will begin in April, which is when the applications are open. At this stage, candidates will submit their application in line with the published eligibility criteria, the programme entry requirements, and the required supporting documentation. During this period, then, we will focus on providing guidance and clarity to ensure the candidates understand the requirements and the expectations of the programme. The next phase will take place in June and July. Once applications close, RCPI and our team will undertake a structured eligibility, verification and application review process. This would include verification of documentation, assessments against the published eligibility and programme criteria, and the shortlisting of candidates in line with the specialty-specific requirements and available training posts. The final stage then takes place in September. Shortlisted candidates are invited to attend either an in-person or online interview, which are conducted with the relevant key stakeholders. Following this process, outcomes are communicated, and the onboarding and pre-arrival process for the successful candidates will begin in preparation for their entry into the programme. Overall, this phased approach ensures a fair, transparent and robust recruitment selection process that's fully aligned with our RCPI governance, quality standards and programme requirements. With that in mind, I'd now like to show you a quick video that will walk you through the structure of the application process and provides a helpful visual overview of the journey from start to finish.
The process of joining one of RCPI's prestigious international programs couldn't be easier. When you're ready to apply for one of our residency or fellowship programs, you can start your application online and through our website. For residency, you need to have completed your degree through English, completed or be near completing a structured internship. For fellowship, you need to have completed a primary medical degree through English, completed a structured internship, completed a national residency program, and passed the associated final board examination. For both residency and fellowship programs, you will require provisional sponsorship from a government body we have an agreement with. Remember, you don't need to have an English language certification or MRCPI to apply for either program. Make sure to submit all required documents correctly, and if you have any queries, just reach out to the RCPI team and we'll be happy to help. If your application is shortlisted, you'll be invited for an interview in one of the Gulf Cooperation Council countries. Successful candidates receive an offer within a few days. Officially accept your offer by email. The RCPI team, along with Castell Education, will support you right through onboarding into the program and training itself. If you need to meet English language proficiency requirements, we offer one-on-one tutoring to prepare for the OET or IELTS examinations. For those joining the residency program, RCPI tutors will provide tutoring and access to a question database for the MRCPI Part 1 examination. RCPI and Castell Education will help you register with the Irish Medical Council, visa applications, and finding accommodations, schools, and childcare. We even assist with everyday tasks like opening a bank account. You will arrive in Ireland 2 weeks before your start date to settle in your new home, attend an induction day, and then begin your journey to advance your medical career in one of our Irish hospitals. Graduates from the Royal College of Physicians International Residency Training Program and International Clinical Fellowship Program have gone on to achieve the following roles and advancements in their careers. Apply to an international program with RCPI today.
Thank you. I'll now hand you back over to my colleague Adam, who will talk you through the onboarding process.
Thanks, Paula. So hi again. Within the Global Training and Partnerships team, we have a dedicated coordinator to help you progress through the onboarding process. So as we can see here, the first stage of the process is the one-to-one onboarding meeting, which really is an opportunity for a coordinator to introduce themselves to our candidates. The one-to-one meeting also gives candidates an opportunity to ask any questions you might have as you embark on your training journey with RCPI. We then refer you to our brilliant colleagues in Castell Education for English language tuition or relocation services. At this stage, we will then refer to our GIM or Pediatrics RCPI clinical tutor, who will help you prepare for the MRCPI Part 1 in advance of commencing the program. The next step then is to liaise with the relevant program director, who will confirm your clinical placement or your hospital allocation. So this is confirmed well in advance of your program start date to give you enough time to secure accommodation in your allocated training centre. Once each of the above steps have been complete, we can then apply for your work permit under the atypical working scheme, which is needed in order for you to take up your post in Ireland. It's pretty straightforward, and RCPI will apply for this on your behalf. Coming towards the end of the onboarding process, Castell will then assist you with your entry visa application, while also advising you regarding your travel plans from the Middle East to Ireland. And provided the candidate successfully moves throughout the onboarding process and has arrived in Ireland, you will then hand it over to my colleagues in the international delivery team, who will then support you for the duration of your training program in Ireland. Thank you. I'll hand you over now to our colleagues in Castell. Hannah Flynn.
Thank you so much, Adam. Good afternoon, everyone. So yeah, as Adam said, my name is Hannah and I'm head of postgraduate services here at Castell Education. So what I'd like to do just for the next few minutes is just tell you a little bit about how we here at Castell can make your transition to Ireland that little bit smoother with our personalised English language tuition support and a range of pre-arrival and post-arrival in-country support services. So next slide, please. So for any trainees who have yet to meet their English language requirement, as Adam said, they will refer you to us here at Castell for English language preparation. So the first thing we'll do is we'll send you a welcome email just outlining the English language service that we provide. We'll then gather information from you on your exam preference, be it IELTS or OET, your level of English, if you have any exam booked already, and your availability for tuition. So each trainee is assigned a personal, professional English language tutor who'll contact you to schedule one-to-one classes. So your tutor then will carry out an initial diagnostic assessment just to determine your level and any gaps or skills that require the most attention. So we also provide a correction service if you wish to submit pieces of writing, and there's one-to-one speaking practice available as well. So your tutor will track your progress, and then feedback is provided to RCPI on a fortnightly basis, just in relation to training engagement and progress. So Castell will work with you then until you sit your exam, and then once you receive your results, we'll review them, and then where a trainee hasn't met the requirement, you'll continue on with the English language tuition. But then where a trainee has met the English language requirement, they are then referred on to begin the first stage of the relocation supports. So next slide. So when you're referred then for relocation support, the first thing that we'll work with you on is your medical counsellor registration. So we'll provide really detailed, easy to follow step-by-step guidelines for each part of the process, from how to get your credentials verified in EPIC, to how to complete your online medical council application form, to getting your documents notarized. And we'll also review your application form and all the supporting documents with you before you submit, just to make sure that you're fully prepared. In terms of immigration services, once your work permit, your atypical working scheme letter of approval is issued, we'll send you really detailed guidelines on how to apply for your visa. If you're bringing family with you, we'll also give you guidelines on how to complete their visa application form, and we're happy to review all the application forms and supporting documents for you before you submit. Then when you're here in Ireland, we'll guide you through the process of applying for your Irish residence permit, your IRP card, which essentially takes over from your visa. And then at any time, should you need to travel to any third countries for courses or conferences as part of your program, we can provide you with advice on how to apply for a visa for that country as well. So in terms of accommodation, the next slide, please. Castell will support you every step of the way, from first of all giving you advice on temporary accommodation options for your initial weeks here in Ireland, to establishing your accommodation preferences, then based on your requirements, sending you permanent accommodation options for your consideration. So we'll be happy to liaise with agents and landlords on your behalf. We'll be happy to arrange viewings for you for any properties that you're interested in. We'll guide you through the application process. We'll give you some templates and reference letters that you'll need. So we're happy to submit the applications on your behalf. And then once you've been accepted for a property, we can review the lease for you before you sign and just give you any advice on moving in procedures and setting up your utilities. Then for trainees who come to Ireland with children, we can help you in your search for schooling or childcare places. So when your hospital is confirmed by RCPI, we'll work with you then just to establish your school or childcare requirements, and we'll contact those schools and creches on your behalf to establish vacancies and forward you the options in for your consideration. So once you send us in your travel details, we'll arrange a driver to collect you and your family at the airport and transfer you to your temporary accommodation. You'll be provided with a personalised welcome back upon arrival. We'll have an out-of-hours support service available to you just in case of any emergencies during that initial transition period. And we're happy to arrange then post-arrival welcome video calls with you just to help you to focus on what to prioritise during your initial weeks here. And then we just give you a lot of information and advice on settling into life in Ireland. So like opening your Irish bank account, getting an Irish mobile phone number, setting up utilities, getting health insurance, if you're interested in renting or buying a car, getting your PPS number, finding a local GP, information on the local public transport network, all those kinds of things that just to help you as it gets settled. So next slide, please. And that support then is available to you for the entire duration of your program. So should you need to rotate to a new clinical site for your second or third year, we're happy to support you through moving out of your accommodation, moving into new accommodation. If you have further education requirements for your children, each year then you'll need to do some things like renewing your IRP card, renewing your medical council registration. So we'll guide you through all those processes. So anything or any queries that you have of a non-academic nature, just always feel free to ask us. And then all the way to the end of your program, when we give you some information and advice on preparing for your departure from Ireland. So yeah, I suppose that just gives you a little bit of insight into the role that Castell plays here, and just on how we can help you and just try to make your transition that little bit smoother. So thank you.
Great. Thank you, Hannah. And thank you to everyone who has presented so far. I hope you have all found this session useful and informative. We're now going to move to the final part of today's session, which is our panel discussion. This section asks our panel trainee-focused questions to give you a clear insight into the international residency programs and the takeaways. So you are welcome to submit questions in the Q&A chat box during this session, and we will be happy to answer them. So on today's panel, we are joined by Professor Cecily Quinn, our International Clinical Director and Clinical Lead for Histopathology. We are joined by Prof. Basil El Nazir, International Clinical Lead for Pediatrics, Prof. Danny Sherian, our International Clinical Lead for General Internal Medicine, and I do think we're expecting Dr. Suzanne O'Sullivan from the International Clinical Lead for Obstetrics and Gynecology, along with Sinead Whitley, our Director of Business Development and Exams. So, Professor Quinn, I might start off with you if that's okay. What does a typical day for a histopathology resident involve?
Thank you very much, Paula. Hello, everybody, and thank you very much for attending the webinar. So a typical day for histopathology, just to say at the outset that when we're training residents or basic specialist trainees in histopathology, the whole ethos of training is that the trainee is involved in the delivery of the service under supervision, really from the commencement of their training. So a typical day would start with a meeting in the morning, just planning the day's activity, and that's usually followed then by what we call the cut-up, and that's where the large specimens are examined by a pathologist in detail. And this specimen might be a colon or a breast or a bladder or a uterus or whatever. So really pathology is really the original medicine. We're right at the interface really with the human body. So the idea then is you take account of the clinical details, examine the specimen, and then guided by the supervision, you take appropriate blocks, and that process then is complete. Okay. There's some interference, I think.
Sorry to interrupt you, Professor. If everybody else could go on mute just while Cecily is speaking, maybe that would help. Thank you.
Oh, thank you, Sinead. Thank you. So that's the first really part of the process. And then the second part then is, that later that day, then slides will be generated from the previous day's cut up. The trainee will then examine all of those, review them under a microscope or on a computer, depending on whether the department is digital or is still using microscopes. Most of us are still using microscopes here in Ireland at this point in time. And then you review those, prepare a report, and then all of that then is reviewed by a consultant, ultimately resulting in the generation of a clinically focused report. So that is really sort of the service side of the day's activities. During the day, there may also be a formal lecture, there might be a journal club or a slide teaching session. So essentially, the trainee does similar work really to the more senior trainees, but with a much greater degree of supervision. I'm happy to answer any questions really on that topic, but that's just a very sort of brief outline of what the day entails. So you work closely with your colleagues, closely with the consultants, and closely with the medical scientists.
That's great. Thank you, Prof. Quinn. Prof. El Nazir, I might come to you then, if that's okay. What does a typical working day or an on-call shift look like in pediatrics?
So thank you very much again for all the people attending the webinar. And as Professor Quinn have just outlined, the basic thing is that it's obviously there is the continuous clinical work under very clear supervision. So clinical supervision is paramount in this program. A day would definitely entail, if we divide the duties into kind of three main things, there's the acute inpatient care and the outpatient clinic and on-call responsibilities. Now, I have to say these are all supported by senior presence. So if you're on call, you have a registrar supporting you. And during the inpatient or acute inpatient care, this would involve seeing the patient before the clinical ward round, making sure that all the investigations that were ordered are there, and obviously having an update on the patient for the clinical ward round. Then, generally speaking, we'll have the outpatient clinics, and you will be assigned patients to see, again, and report back to your senior, be it the registrar or the consultant, and you'll be encouraged to make a clear decision plan about how would you manage the child that you've seen or the patient that you've seen. So yes, acute inpatient care, outpatient clinics, and on-call responsibilities.
That's great. Thank you, Prof. Prof. Sherian, I might come to you. What does a typical day look like for an internal medicine resident?
Thanks, Paula, colleagues, and thanks for all the attendees. So yes, the the typical day for an internal medicine resident is it's a busy one. It typically starts with an early morning round. The day usually starts anywhere between 7:30 and 8 in the morning. It depends on the firm you're working with. Some firms will start off with a multidisciplinary meeting where you might have a radiology meeting, sometimes an interdisciplinary meeting with specialties like physiotherapy, occupational therapy, etc. But most will start off with a general ward round. So what this will entail is meeting together with the rest of the team. This will include the interns who will be more junior than yourselves, along with the specialist registrars and fellows who will be supervising yourselves, along with the consultant as well. At any one time, you would expect somewhere between 15 and 30 patients on your list, and these patients would all have to be reviewed, generally during the course of the morning. Generally in terms of priority, in terms of who is sickest. And then those patients are then, a plan is formulated, acute medical issues are addressed. These are then reviewed with the senior partners of the team to make sure that everyone's happy that the right management strategy is in place. And then generally speaking, later on in the day, the jobs that are required to be done, for example, following up with scans, writing discharge letters, re-reviewing patients if needed, etc., can be done. Again, depending on the firm that you're with and the specialty you're in, outpatient clinics, for example, often happen several times a week. And certain specialties will have the opportunity to get involved in observing procedures. For example, in cardiology, you might spend a bit of time in the cath lab or in endoscopy with gastroenterology. So hopefully that's a brief, helpful outline.
That's great. Thank you, Prof. Sherry. Dr. Suzanne O'Sullivan, I'll come to you. What obstetric emergencies will a trainee be trained to manage?
Thank you, Paula. So I suppose obstetrics is quite a broad specialty. So we would expect trainees to start on the labour ward, initially observing, assessing patients, examining them, and over time they would gain skills in vacuum deliveries. We sometimes also use forceps in suturing perineums, and then obviously you've got cesarean sections, and they can vary from being simple and straightforward to very complex cesareans. So over time, competencies are gained looking at all of these procedures. Another thing that we would often do frequently is fetal blood sampling on the labour ward. So the trainee would first observe and then under very close supervision gradually gain competencies in all of these obstetric emergency procedures.
That's great. Thank you, Dr. Sullivan. Professor Quinn, I might go back to you. How many hands-on exposures will a trainee have to specimen analysis?
Thank you, Paula. Well, really just that's very similar to what I said earlier, just in terms of hands-on experience, the essence of training is involvement in the clinical service delivery from the outset. So our trainees are introduced to all aspects of diagnostic histopathology, specimen dissection, slide review, report creation, and also we encourage our trainees to attend the multidisciplinary team meetings. Here at St. Vincent's, we have several in different specialties every week. And that's a great opportunity to present the findings, to understand the clinical implications of your diagnosis, and to work with team members to optimize patient care. So it's a very hands-on specialty in terms of experience and of training. So I think it does prepare junior trainees very well, for progression through their training.
That's great. Thank you. Prof. Al-Nazir, what are some of the common pediatric emergencies a trainee might encounter?
So yes, I mean, obviously you'll be encountering the full gamut of pediatrics, starting from simple things like a gastroenteritis that the child needs to be seen and admitted possibly for rehydration, but mostly depending on the seasonality. We're a very seasonally based specialty. During the winter months, viral infections, asthma exacerbations, but you'll be exposed as well to meningitis, sepsis, epilepsy, status epilepticus, all that kind of full gamut of pediatrics that you would see here. There is also the exposure within certain units to neonatology or neonates, whereby if your placement was in a general hospital, you'll be attending some of the deliveries, or if it's in a tertiary maternity hospital, you'll be attending deliveries and as well expected to play some part in the high dependency or intensive care unit for these neonates. So yes, it's a wide range program, and it involves general pediatrics at the core, but there are subspecialties within general pediatrics that the candidate will get exposure to.
That's great. Thank you. Prof. Sherian, how are ward rounds structured and what role does the resident play?
Thanks, Paula. Yeah, so similar to the last answer, it very much depends on the specialty you're with. But for example, if I can speak to you specifically about on my gastroenterology team, so we have a number of patients who will be sick with liver disease, bleeds from the intestinal tract, or say inflammatory bowel disease. So the ward round is typically structured based on priority. So if we have sick patients in the intensive care unit or the high dependency care unit, I would expect that the team bring me there first. Prior to that, I would have expected the junior doctors, which would include the residents, to have seen the patient, find out any updates from nights that may have happened overnight, any recent updates in blood tests, vital signs, or scans, etc. And generally, what we then do is, because the patient should have been seen by the resident and the fellow, the patient's clinical case is then presented to me or to the relevant consultant. We then go through the differential diagnosis as to what could be going on and formulate a management strategy. So generally, that is the structure of a ward round. Again, it can be a bit nuanced depending on the specialty in hand, but for most of the general medical teams, it'll be something similar to that. And the resident's place specifically will be to be sort of a first port of call for assessing the new patients, assessing the existing patients who may have developed new clinical issues during their inpatient stay, and to try and formulate a smart plan based on best evidence to determine how that patient should be treated. But of course, there's a lot of supervision and oversight for that plan to be implemented. So at no point will that resident feel unsupported in their decision making.
That's great. Thank you, Danny. Dr. O'Sullivan, how much hands-on experience will a trainee receive in a labour ward?
And again, I suppose the experience is well, again, it's a very gradual introduction to it. So obstetrics and gynecology is a broad specialty. So part of your time is spent in obstetrics. Part of that time is going to be doing ward rounds. It's also going to be doing antenatal clinics. And then there's obviously labour ward sessions and the on-call, which will cover emergency room wards and the labour ward itself. So over time, you know, it's a very gradual gaining of skills. So we'd, you know, again, starting off observing, looking at suturing first, doing partial, you know, assessments for deliveries, and then getting hands-on experience with vacuums, with FBSs, with sometimes forceps, and with cesarean sections. So again, it's a very gradual sort of development of these skills. And, you know, sometimes you may end up sort of doing more seeing and getting exposure to more vaginal births and fewer cesareans, and then things change. So it's impossible to completely predict, but all of our labour wards are pretty busy and there's plenty of exposure and plenty of experience to be had.
That's great. Thank you, Dr. O'Sullivan. I just have one more question for the clinicians, if that's okay. Professor Quinn, what type of biopsies or specimens will a trainee see?
Great. So pathology is indeed a very, very broad specialty and really encompasses the whole of medicine and surgery and everything else. So in the course of your training, you become knowledgeable about really every aspect of medicine. So most hospitals really cater for a number of specialties. So for example, in Dublin, our trainees from the Gulf countries tend to go to St. James's and St. Vincent's. Those two hospitals are quite complementary. Here at St. Vincent's, we are very strong on breast, GI, GU, dermatopathology, soft tissue. St. James's Hospital is particularly strong on gynecology, GYN pathology, and also on ENT and on lymphoreticular. So we find that the two hospitals are very complementary. So you really get exposure to a very broad range of specialties, both large resection specimens that result from surgery and also from biopsy specimens such as endoscopic biopsies, bronchial biopsies, etc. The other centre in Ireland where the trainees tend to spend a period of time is Cork, and it's a very, very large hospital with pretty well every specialty represented under one roof. So there's good exposure really across the board. Thanks, Paula.
Thank you, Prof. Prof. Al-Nazir, what does the department provide in terms of teaching, and how much exposure would a trainee receive in neonatology?
So we'll start first with the second part of your question, Paula, about neonatology. The general hospitals that we have, some of our trainees that will go there for placement will have a maternity unit attached to them. We do have the national maternity hospitals, the 3 big hospitals in Dublin, whereby the care is usually, the exposure would be for, extreme prematurity babies or complex pregnancies. And in our program, we factored a portion of the time that the resident will stay will be affiliated to one of those big tertiary centers. The exposure to neonatology in a general hospital would be attending probably a cesarean section, attending to the delivery suite calls. And again, all this would be supported by, at the appropriate level, and depending on the level of expertise and skill of that resident, they'll be supported by the registrar or somebody, or a fellow or a senior person. That's from a neonatology point of view. In terms of the education, we have the National Children's Health Ireland has got a weekly grand round, and that would help everybody all over the country, irrespective of where you're training, that you can have access to the complex cases being presented with kind of state-of-the-art intervention, etc. So that's available to everybody. There are, within every unit, there are journal clubs, there are case presentation or local grand rounds that the residents would be encouraged, first of all, obviously, to attend, but more importantly, to participate by actively presenting there, because we believe that obviously the resident should be encouraged in terms of the educational needs, plus would be expected as well to present something either at a national meeting or within their hospitals. There are some mandatory courses by the Royal College of Physicians of Ireland that the resident will be encouraged to attend and participate in that. So every step is actually supported by clear education. There is an educational supervisor as well that will be looking after the whole period of residency of the candidates.
That's great. Thanks, Prof. Basil. Prof. Sherian, what kinds of acute and chronic medical cases, will a trainee commonly see?
Yeah, so thanks, Paula. This can be a wide variety. We have 2 broad groups of patient interactions. We have what we call scheduled care. And scheduled care are patients that are coming into clinic, say, for example, for chronic diabetes management, COPD management of their liver disease. And then we have the term we use here in Ireland is unselected take, or these are patients that are coming in an undifferentiated way onto the medical service via the emergency department. So as you all know, we have a really aging population, and aging population, older patients have complex care needs because it's very rarely just one issue that they're presenting with. So a common presentation in an older person, for example, could be a urinary tract infection or a lower respiratory tract infection. But along with that, you would have issues with delirium or maybe a background history of dementia as well. They may have had a fall, they may have injured themselves. So there's often complex care needs that draw in the need for a multidisciplinary team. Other examples of sort of acute on chronic disease type conditions may be things like exacerbations of COPD, particularly during the wintertime. There's a lot of infective exacerbation of patients with COPD or those who have underlying pulmonary fibrosis. We have exacerbations of CCF, patients who have known heart failure, maybe coming in with acute exacerbations of their heart failure symptoms. Patients who have complications of diabetes, but also new presentations of diabetes, diabetic ketoacidosis, and diseases such as that. And then you have an acute setting within the unselected medical take, and these will often be directed towards specialty teams, depending on the time of the day and depending on the hospital. An example of this could be an acute ST elevation MI. If this is during working hours, that patient would be seen and clerked usually directly by the cardiology team on call, of which you would be part of as the resident. Likewise, the stroke team would take a stroke patient directly with a new onset of a stroke. In the middle of the night, these patients are often admitted under general medical teams and are managed and then transferred to appropriate teams the next day. So a wide variety of pathology, both inpatient and outpatient. Thanks, Paul.
That's great. Thank you, Danny. And then Dr. O'Sullivan, what teaching opportunities exist, if you could talk us through them, such as simulation, drills, and tutorials?
So, well, I suppose every really your whole working day is an opportunity to teach and learn. So ward rounds involve a lot of teaching. Labour ward rounds the same. Again, we will have journal clubs. We will have MDTs, gynae MDTs, maternal and fetal medicine MDTs. We have grand rounds most of the time at the end of the week, and again, a lot of bedside teaching. There are RCPI courses as well. But all of the maternity hospitals in the country also run very regular skills and drills for obstetric emergencies. So these happen on a frequent, not necessarily a scheduled basis, because they're multidisciplinary. They can be organised by midwives or the obstetric or anaesthetic team, and all units run prompt courses very regularly. So it's mandatory to be up to date on your prompt training, and prompt is a very advanced simulation training in-house that looks at obstetric emergencies like maternal collapse, shoulder dystocia, impacted fetal head, etc. So there is a wealth of training, learning, and teaching opportunities during the day throughout the working day in obstetrics and gynecology.
That's great. Thank you, Dr. O'Sullivan. And thank you all. I think everyone would agree that that's been really insightful and extremely valuable information for our audience today. So we do appreciate you taking the time out of your busy schedules to be here. I'm going to move on to our final question of the day, and this will be for Sinead Lucy. Sinead, as our Director of Business Development and Exams, what is the one key takeaway from today's session that you would like the audience to remember?
Thanks, Paula. I might just name a couple of takeaways, if that's okay. The first is, I mentioned alumni of these programs earlier, so we would really encourage you to reach out to alumni to get a sense of what the experience is like, how to prepare, especially for things like the MRCPI examination if you need to take one. And then critically, I would also advise to engage with Castell, our onboarding partners. So Hannah gave a great presentation there earlier. Look back on the detail, engage with them as soon as you can from an English language preparation perspective. If you need to organise childcare accommodation, the earlier you do that, the more seamless the process will be. We'd also encourage, and it's not always possible, I appreciate sometimes there can be delays, but if you can be here on time, so the start day in July is really important, and to attend orientation, because both at the hospital site and with the Royal College of Physicians, because you'll meet the team that you're working with and your trainer all at the same time, and I think that really does benefit the trainee to get off on the right foot. Read through your curriculum, make sure the conditions of the residency program, things like on-call, be aware of what the expectations are of you. And really, at a personal level, if you come to Ireland, engage here with the country, travel around, get to know the people. It's a wonderful country, and also Europe is a short Ryanair flight from here. So if you can and you're in a position to travel around Europe as well, I'd highly recommend that. So that's it really for me. And to echo, thank you to everybody on the panel, especially our clinical colleagues, because it is a busy time for you. So thank you for taking the time, and we'll be circulating this recording widely amongst our partners. So again, thank you, and thank you to Hannah as well, specifically from Castell, for attending as well. Thank you.
Thank you, Sinead. So I think, yeah, just to follow on what Sinead has said there, I'd like to thank everyone and obviously our panelists and speakers for their time today, and to our RCPI team for arranging the session. I would encourage everybody to visit our RCPI website, where you can access the e-brochure. We have also popped it in the chat, and it is available here if you would like to scan the QR code, which will bring you directly to it. And I think I'll close today's session now by saying thank you and enjoy your weekend.
Thank you, Paula, and thank you, Sinead, very much. And
Thank
everybody
you.
else.
Thank you.
Thank you
Bye-bye.
all.
Bye.
Thank you.
Bye.
Thank you. Bye.